Here's how we're going to organize the day in a 3-step process. So I'm going to go over each of the 10 LSP components. These are the protocol assessments. Just briefly hit on those. And then we're going to talk about a specific ASD behavior challenge question that typically comes up when I observe and develop programs. These are very common questions. And then we're going to talk about some speech therapy design considerations so that we can take the learning style weaknesses and some potential behavior challenge pitfalls. We understand that going into the session. So, hey, let's get smarter before we even get out of the blocks so that we can pretty much assure that the session is going to go better and not, again, disintegrate in the first few minutes. The 5 questions of structure. Oh my gosh, I cannot tell you how much I use the 5 questions of structure. This is a visually based system, and I borrowed this from Division Teach. And the questions are, where am I supposed to go? What am I supposed to do? How much are we supposed to do? How do I know when we're done and what comes next? This visual structure that we'll talk about more in just a minute, but this visual structure, oh my gosh. When you have this visually structured layout, like when a child walks into the room, there's no question about where they're going to go. You don't have to start telling them where to go. They just know based on your visual structure. Whatever's on the table, this is what we're going to do. There's not going to be any argument about what we're doing because it's visually laid out. It's very clear what we're going to do. You've laid it out because you've designed this. How much are we supposed to do? For kids who have shared control, make sure you visually design how much you're going to do. It's pretty clear by looking at the activity how much we're supposed to do. We're going to do 3 pages or 10 turns worth or whatever. You just build in this visual, pretty much roadmap of what you're going to do. How do I know when I'm done? Not because you say I'm done, not because I say I'm done, not because anybody else is done. The activity tells all of us when we're done. And what comes next, we'll talk about this again in a minute. After we get done with this agenda, what comes next? Who's the coach? What's the agenda? Where are we going? All visually laid out. Guys, anytime that this activity that you are developing in your speech therapy is not visually organized, that means you have to tell them what the design of the activity is. And you're opening yourself up for argumentation, for negotiation. And then you develop what's called a winner and loser scenario. Because some kids get really good at, you've seen how I've broken out these columns of initiation, maintenance, and response. Some of our kids are really good at the initiations, as I just mentioned. They're really good at getting things by requesting, directing topics or other people's actions, greeting and showing and giving. I mean, these kids, when they're in charge, they're in their lane. All right. So when they're asked to respond by answering questions or responding or following somebody else's lead, they're not used to that. All right. So I know we all want to start with initiations, getting kids to initiate, but boy, be really careful of that, because that will become that child's interaction style. Oh, I'm used to being in charge. This is the way my life goes, and everybody else needs to, follow my lead, stay in my lane. No. As you're designing these speech therapy sessions to avoid that potential conflict about, I'm in charge, I want to do what I want to do, and my interaction style supports me taking the lead, making sure you develop these coach rotations. The adult sets the stage, peers participate with the coach. Child learns from peers. You start rotating where the peers then are the coach, and then the adults and the child with autism start following their lead, and eventually the child gets to be in charge, taking the lead, given that the theme and the agenda has already been established. So you really want to work on what we are doing, child, and then as you're developing these joint action routines and with the purpose of interaction style, make sure that you have a really nice balance. Some days work on initiations where the coach is modeling and demonstrating to the peers how to initiate for these pragmatic purposes. Other days you want the coach to be able to model and demonstrate with the peers how to respond. And these are the pragmatic functions of response. Other days you want to have the coach be able to model and demonstrate how to keep glued with each other by maintenance pragmatic functions. All right. So the point that I'm trying to make is, as you're designing your speech language therapy sessions, build in this balance and don't just work on initiations, because the child will take you to the cleaners if that's the way they see the world going. Does your child react while in his or her comfort zone when presented with potential threat interference of a social partner? So what do I mean by that? Well, when a child comes into the therapy room or the classroom or your therapy situation, all right, and a child is in their comfort zone, typically what that means for many kids who are object-oriented is, I'm on the floor playing with objects, here's my focus, my head is down, and so this is my comfort zone. Nobody's bothering me, I'm just doing what I do, which is object-oriented learning. That's my comfort zone. All right, now, what happens is that you as a therapist will go, oh, wait. That's not what we're doing. We're not playing with the objects. I have something else in mind for today's therapy session. So immediately there's a confrontation. So you walk over to the child and go, hey, let's put that away. We're all done. And the child goes, what? And they get surprised. Okay, and the information comes too much too quickly when you come over to the child, because again, their head is down. All of a sudden, here you are. Too much information too quickly. And then the child oftentimes doesn't have a real tolerance for being surprised and having too much information too quickly. And so then they react, because you have to get control of the situation to move on with your therapy goals and objectives of that day. But they might have something else in mind. Boom. All right. Now, what do? Hand over hand, get very directive, get really chatty. Then this breakdown that I just mentioned starts to occur. Happens all the time. How do we design a therapy session to accommodate and try to mitigate that from happening? Well, for kids who are object-oriented, 3 things that you may want to consider as you go into the therapy session as you're designing. First of all, clear the room. Don't give objects to the kids at first, and don't let the kids go first. It's like, okay, I need to explain what I mean.